Hi, my name is CJ, and I'm glad to be here with all of you tonight to discuss such an important topic. Welcome to today's webinar. Are you or your child at risk for type 1 diabetes? Understanding the genetics and hidden signs at Diabetes Sisters, our mission is to support and empower individuals living with all types of diabetes through education, resources, and community. Tonight's conversation is especially important because of early detection of type 1 diabetes. Type 1 diabetes can have a profound impact on outcomes for individuals and their families. We're honored to be joined by our expert speaker, Dr. Victoria Bouhairie. Dr. Bouhairie is a board certified in endocrinology, diabetes, and metabolism, as well as in lifestyle medicine. She is the founder and CEO of Perry's Wellness and Diabetes Center and a proud board member of Diabetes Sisters. She's deeply committed to improving healthcare outcomes and advocating for population health initiatives. In addition to our speakers, we're so thankful to have three incredible women joining us to share their personal experiences with type 1 diabetes: Jamie Klein, Alejandro Marquez, and Tia Ware. Thank you all for being willing to share your stories with us. Before we get started, we have a few housekeeping items. You're welcome to use the Q&A box through the first half of the presentation. Our speakers will be happy to address your questions during the second half of the event. Once the presentation concludes, we'll transition into a breakout rooms for a live Q&A. This will give you the opportunity to speak directly with our speakers, ask questions, or share any concerns in a more personal setting. We're honored to be joined by our expert speaker, Dr. Victoria Bouhairie, who will now begin with a brief presentation to help us better understand the importance of early screening for type 1 diabetes. And now I'm going to turn it over to Dr. Bouhairie.
Thank you, CJ, for that introduction. Hi, everyone. I'm very excited to talk to you about this very, very important topic, which is screening for type 1 diabetes. So let's kick it off with what is type 1 diabetes? Type 1 diabetes is when the pancreas cannot produce as much insulin in order to help control your blood sugar levels. There are cells within the pancreas called the beta cells, and these beta cells can be destroyed by certain group of cells within your body called T cells. The T cells go and attack the beta cells, and as a result of this destruction of the beta cells, insulin levels go down, and also there's some antibodies that arise as a result of that. Overall, you have a decrease in the ability of your body to control the amount of blood sugar in your bloodstream, and that can lead to high levels of blood sugar, and that can eventually result in what's called diabetic ketoacidosis. We all know that living with diabetes can be challenging. There's constant need to monitor your blood sugars. You need to know how to balance your meals, exactly how much insulin to take per meal. You also need a support team, someone that you can trust, someone who is available to you, someone that who you think is a reliable support system. What to do with common things such as exercising. And also the constant need for insulin. This could be a financial burden. And also the need for it every single day can cause emotional struggles. We do know that with type 1 diabetes, you have increased risk of depression as well as what we call diabetes distress. When we think about family history, what we know is that if you have both parents living with diabetes, you have an increased risk of developing diabetes, and that's up to 30%. If you have just the father, then that risk is 3 to 8%, and a mother only, then that's 1 to 4%. So having a family history of type 1 diabetes does increase your risk of having type 1 diabetes. But it's very important to know that over 85% of people who develop type 1 absolutely have no family history. So that's really the majority of people. They really don't have a family history. So when the diagnosis of type 1 comes into the scene, that's really a surprise. And unfortunately, 40% of people are diagnosed with diabetic ketoacidosis, and this is a life-threatening condition. And they're diagnosed at the time of diagnosis of type 1 diabetes. So it's very important to know that diabetic ketoacidosis is life-threatening. And then again, you have that 40% that when they're diagnosed with type 1, they're in diabetic ketoacidosis. So there are many stages of type 1 diabetes, stage 1, 2, and 3. What we tend to recognize diabetes commonly is really that stage 3. And that's where you have the clinical signs. You have increased urination, thirst, and then very high blood sugar levels. In stage 1 as well as stage 2, there aren't any clinical signs present. However, you do have higher blood sugars in stage 2, not as high as in stage 3, but higher than normal. But in stage 1, you do not have any elevated blood sugar levels, and also you don't have any signs. However, you do have those antibodies that I mentioned at the very beginning of the presentation that are present. As long as you have more than two antibodies present, there is a diagnosis of type 1 diabetes. And then, depending on whether your blood sugars are normal or if you have clinical signs of type 1, you're either in stage 1, stage 2, or stage 3. So, why do we screen? We really screen to see if we can identify these antibodies early. And the reason why this is important is that number one, we can really reduce that risk of diabetic ketoacidosis. I did mention that this is a life-threatening condition. And what we know is that if you are screened and monitored in a monitoring program, the risk of diabetic ketoacidosis can decrease from that 40% all the way down to less than 5%. You can also decrease hospitalizations, again, because you're being monitored. You'll have things in place, be it blood sugar monitoring device or continuous glucose monitoring, where you can prevent elevated blood sugar levels, which can lead to hospitalizations. And then you have time to prepare a support group, what endocrinologist or primary care provider that you like to go to. You have time to do your research, learn about type 1. You also have time to see if you want to enroll in any clinical trial or seek early treatment in one of the advanced medications that have come out recently that have helped to really slow the progression from type 2 diabetes to, sorry, from stage 2 diabetes to stage 3. So when we're talking about screening, we're really looking for those antibodies that I mentioned. And there are four antibodies that the American Diabetes Association recommends. These are the zinc transporter 8, the GAD antibodies, the islet antigen 2, as well as the insulin autoantibodies. The presence of two or more of these antibodies does indicate that you have type 1 diabetes. And if some people will need to confirm as if there's a positive test, the next step will be to confirm that. And some people might just have one. If you have one antibody present, that does not give you the diagnosis. It does have to be two or more antibodies. And this test is a very simple blood test. It could be done through a finger stick, or it could be done through a lab draw through the vein. There are many different places that you can have your screening done. The first two here, the Ask and TrialNet, these are research-based screening programs. They have the option of either mailing you a home test kit, or you can go to a lab center and get the blood drawn there. Other options are state research-based screening programs, such as CASCADE in Washington State or Pledge in South Dakota. You can also do the lab through Enable BioSciences. In this particular type of screening, your provider will order the lab. This will be sent to the provider's office, and then you can get the screening done at the office, or even take the screening home and then mail it to the Enable Biosciences address. Finally, your primary care provider can actually order the test. And this is a very simple order, the same way where you do your annual labs. And you will go to either LabCorp, Mayo, or Quest and get the labs drawn that way. So if you test positive, it really depends on how many antibodies are present, which antibodies are present, etc. What will happen is really regular metabolic health screening. So we will check your blood sugar levels. Also make sure that again you have that knowledge and understanding depending on what stage. If there are more than two antibodies present, we'll look at what stage of type 1 that you're in. Think about treatment options. Teplizumab is one of the treatment options that came in November 2022, in which helps to delay the onset of clinical type 1 from stage 2. And then you can prepare for potential emergencies. You can learn what diabetic ketoacidosis looks like and then prevent it from occurring. And then finally, you have that option to uh, participate in different research that are currently available. So if you test positive, that means that you will need to be frequently monitored just to look at the rate of progression, monitor your blood sugars, and again, make sure that we can prevent diabetic ketoacidosis as much as possible. And here really talks about the medication that I mentioned before, tirzepatide. And this is a medication, again, that was approved in November 2022, and is approved for age 8 and above. It's a 14-day infusion in which they're given every single day for those 14 days. And what we've seen is that people on average prevents the progression from that non-clinical stage 2 to the clinical stage 3 by a mean of about 2 years. The good news is that there's some people that have taken this medication that have been actually that have not had those clinical signs for almost 8 years now. So really variability, but again, a remarkable medication that has really helped change the lives of people in stage 2 type 1 diabetes. For more information about type 1 screening, please go to our website, diabetessisters.org, to get more information about screening, the codes that can be used for the lab draws. We also have a lot of resources from PDF files to webinars that are pre-recorded, and then some downloadable resources also.